Mr. Speaker, today I present an update, a COVID-19 update in our school system. Mr. Speaker, I rise this morning in this Honorable House to provide an update on the ongoing impact of COVID-19 in our schools and the preventative measures that have been put in place in both our public and private schools to keep our children safe. Mr. Speaker, you will recall that our Honorable Premier has shared with us repeatedly, and this morning I say it again, the coronavirus is with us and will continue to be with us for some time. We must accept and make adjustments for what has become our new normal. In our public and private schools, this has meant finding creative and engaging ways to ensure quality teaching and learning environments for students in the classroom, as this is where our children learn best. Mr. Speaker, the beginning of the 2021-2022 school year was not without its challenges. Bermuda was in its fourth and deadliest wave of community spread from the virus. Public school staff were being sent home in unsustainable numbers even before school buildings were fully open. Our private school partners did begin the school year with in-class learning. However, several schools were hit with positive cases resulting in large numbers of students being placed in quarantine. One school had a delayed start and another one completely closed for a week. Mr. Speaker, the increased number of COVID-positive cases caused the Ministry of Education to make the difficult decision to begin the 2021-2022 academic year with remote learning for public schools. Despite the setbacks, there has been continued collaboration with the Ministry of Health to put appropriate safety and health guidelines in place for our schools. Mr. Speaker, let me remind my honorable colleagues that towards the end of the 2020-21 academic year, through collaboration between the Department of Education and the Molecular Diagnostic Lab, MDL, a saliva screening pilot program was implemented in both public and private schools. The pilot program saw staff from MDL visit various schools to conduct saliva testing on consenting students and staff. Ultimately, students and staff consenting to participate in the program were tested at least once per month. The program proved to be successful in identifying asymptomatic cases. Resultingly, the saliva screening program was revised and has continued into the 2021-2022 school year, with all public schools testing weekly. At this point, I want to extend my thanks to our parents and staff for supporting the program and providing consent for their children to participate, as this will help to keep our schools safe. Mr. Speaker, both public and private schools have implemented key COVID-19 preventative safety measures to ensure safety in school buildings. Public schools introduced a pre-return testing policy, and that all staff and students were required to have a negative COVID-19 test to enter school buildings after a break in school. Private schools, on the other hand, have implemented the lateral flow testing for staff and students up to twice a week in most schools, which includes teaching staff, administrative staff, janitorial, and security staff. Mr. Speaker, research has shown that in-person learning is best for our students. The focus of our schools has been to minimize continuous disruption of student learning due to identified positive COVID cases in schools. The Ministry of Health has received input from the Ministry of Education, Department of Education, and our private schools, which has resulted in a revised approach on how close contacts and casual contacts are now treated in the event of positive cases having been identified in school. Instead of having a full class of students having to quarantine, the Department of Health Risk Assessment now allows for persons deemed as casual contacts to remain in school if an initial negative PCR test is obtained. However, close contacts are still required to quarantine as per usual. We are pleased about the change in policy, which has allowed more students to remain in school for in-class learning. Mr. Speaker, since schools have opened for the 2021-2022 school year, there have been 38 positive COVID cases to date, 14 in the public schools and 24 in the private schools. I am certain that the safety measures that have been put in place have helped to identify positive cases earlier and also allowed schools to remain open with continuous in-person learning for our children. Mr. Speaker, earlier this week, the Ministry of Health advised that schools could move from Phase 1 to Phase 2 of school COVID guidelines, which means our younger students from preschool to P3 do not have to wear face masks while inside the classroom. The intent is to review this policy in 2 weeks for a possible move to Phase 3. Many in the community have advocated for a quicker move between the COVID protocol school phases, as other entities in Bermuda have, quote-unquote, opened up. However, Mr. Speaker, I do wish to remind all that our schools are considered high to medium risk locations. Students are in classrooms approximately 3 feet apart from 8:30 a.m. to 3:30 p.m. daily. A relaxation of the school protocols too quickly and leading to an outbreak could cause an entire class or year level to be quarantined. This would negate our recovery and our movement towards a new normal. Mr. Speaker, each child sent home typically results in that household being quarantined. A household in quarantine can affect a parent's ability to work and other siblings' inability to attend school. Those other siblings may result in fellow students at other schools being affected and their respective households as well. If we stop and think about this, it is easy to see the potential knock-on effects of a positive case in a school. We want to, and we will, ease the restrictions, but this will be done with a need to balance the safety of our children and the need for them to remain in school. Mr. Speaker, this last outbreak, approximately 1/3 of the cases were children. And to my understanding, a few cases can be traced back to parents sending their children to childcare settings where other children were infected and then returned home to infect household members. While children may not be affected by COVID as adults, children tend to be around their elders, which may be more susceptible to COVID complications. With our prevalence of multi-generational households, this can be a real issue. The guidelines in schools have allowed us to have schools open and keep them open, but at the same time protect our community. Mr. Speaker, we will continue to do what is best for our students and their families to keep them in school and learning. While this may be an inconvenience to our adults at times, our focus will remain on keeping schools safe for in-person learning. Mr. Speaker, I want to take this time to thank the staff at the Ministry of Education, the Department of Education, the Ministry of Health, the Department of Health School Surveillance Team, the Department of Health School Surveillance Team, our private school partners, and the school testing team at the Bermuda Molecular Diagnostic Laboratory. It is generally the collaborative effort of all involved and their hard work and dedication to ensure our schools have programs that have enabled us to keep our students in school and be protected as much as possible from the COVID-19 virus. Thank you, Mr. Speaker.